Hi everyone and welcome to my channel hube. This video of mine is about placental abruption, which is also known as abruptio placentae. This is an uncommon yet serious complication of pregnancy. The placenta develops in the uterus during pregnancy. It attaches to the wall of the uterus and supplies the baby with nutrients and oxygen. Placental abruption occurs when the placenta partly or completely separates from the inner wall of the uterus before delivery. This can decrease or block the baby's supply of oxygen and nutrients and cause heavy bleeding in the mother. Placental abruption often happens suddenly. Left untreated, it endangers both the mother and the baby. Earlier, I posted a short video about placental abruption, and today I am going to discuss this serious illness in detail. Well, let me tell you the symptoms first. Placental abruption is most likely to occur in the last trimester of pregnancy, especially in the last few weeks before birth. Signs and symptoms of placental abruption include vaginal bleeding, although there might not be any, abdominal pain, back pain, uterine tenderness or rigidity, uterine contractions often coming one right after another. Abdominal pain and back pain often begin suddenly. The amount of vaginal bleeding can vary greatly and doesn't necessarily indicate how much of the placenta has separated from the uterus. It is possible for the blood to become trapped inside the uterus, so even with this severe placental abruption, there might be no vaginal bleeding. In some cases, placental abruption develops slowly, which can cause light intermittent vaginal bleeding. Your baby might not grow as quickly as expected, and you might have low amniotic fluid or other complications. You should seek emergency care if you have signs or symptoms of placental abruption. Now let me tell you the causes. The cause of placental abruption is often unknown. Possible causes include trauma or injury to the abdomen from an auto accident or fall, for example, or rapid loss of the fluid that surrounds and cushions the baby in the uterus, that is amniotic fluid. Now I'll tell you the risk factors. Factors that can increase the risk of placental abruption include placental abruption in a previous pregnancy that was not caused by abdominal trauma, chronic high blood pressure, that is hypertension related problems during pregnancy, that is preeclampsia, HELLP syndrome or eclampsia, a fall or other type of blow to the abdomen, smoking, cocaine use during pregnancy, early rupture of membranes which causes leaking amniotic fluid before the end of pregnancy, infection inside of the uterus during pregnancy, that is chorioamnionitis, or being older, especially older than 40. Now I'll tell you the complications. Placental abruption can cause life-threatening problems for both mother and baby. For the mother, placental abruption can lead to shock due to blood loss, blood clotting problems, the need for blood transfusion, failure of the kidneys or other organs resulting from blood loss, rarely the need for hysterectomy if uterine bleeding cannot be controlled. For the baby, placental abruption can lead to restricted growth from not getting enough nutrients and not getting enough oxygen. Premature birth and even stillbirth can occur. Now I'll tell you preventive measures. Well, you cannot prevent placental abruption, but you can decrease certain risk factors. For example, the risk factor which I told you before, do not smoke or use illegal drugs such as cocaine. If you have high blood pressure, work with your healthcare provider to monitor the condition. Always wear your seat belt when in a motor vehicle. If you have had abdominal trauma from an auto accident, fall or other injury, you should seek immediate medical help. If you have had a placental abruption and you are planning another pregnancy, talk to your healthcare provider before you conceive to see if there are ways to reduce the risk of another abruption. Now I'll tell you about the diagnosis. Well, when the patient comes to us, if there is a suspicion of placental abruption, we do physical exam to check the uterine tenderness or rigidity. To help identify possible sources of vaginal bleeding, your healthcare provider will likely recommend blood and urine test and ultrasound. During an ultrasound, high-frequency sound waves create an image of your uterus on a monitor. It's not always possible to see a placental abruption on an ultrasound, however. Now I'll tell you the treatment. It is not possible to reattach a placenta that is separated from the wall of the uterus. Treatment options for placental abruption depend on the circumstances. Okay, In the first situation, for example, if the baby is not close to full term, if the abruption seems mild, your baby's heart rate is normal and it is too early for the baby to be born, you might be hospitalized for close monitoring. If the bleeding stops and your baby's condition is stable, you might be able to rest at home. You might be given medication to help your baby's lungs mature and to protect the baby's brain in case early delivery becomes necessary. And the second situation is if the baby is close to full term. Generally, after 34 weeks of pregnancy, if the placental abruption seems minimal, a closely monitored vaginal delivery might be possible. If the abruption worsens or jeopardizes your or your baby's health, you will need an immediate delivery, usually by cesarean section. For severe bleeding, you might need a blood transfusion. Well, this was my video about placental abruption. I hope you like this video. If you have any questions about this illness, you can post in the comment section. Okay, and see you in next video. Thank you so much for watching this video. Bye for now.